Okay, great. Well, so thanks for joining us today. I'm Taunton Payne with the U.S. National Institutes of Health. I just want to thank you all for joining and thank RDA for hosting this session and to my co-presenters as well for graciously offering to participate here. This was a bit of a late ask to them, so I do really sort of appreciate their efforts here. So for those of you who were sort of following along with the agenda, I think you may have noticed that this the description for the session has changed a bit. It did sort of evolve a bit from where it was before, and I think sort of mostly what it was trying to do is to, I think, kind of focus it a bit based on some comments that we received from the advisory board on sort of first draft. And really what it's trying to do is to kind of focus on the issue of data management and sharing policies and plans and sort of the cultural change that I think those things are trying to achieve. And so our plan for today is to kind of focus on this. And just as a bit of a background, this session came out of a sort of internal conversation at NIH among different RDA members, since there are actually quite a few RDA members at the agency, wondering about whether there was sort of a home for the discussion of sort of cultural change and issues, around that. And so bearing that in mind, I think the goals for today's sessions are, first off, to kind of raise awareness of the NIH data management and sharing policy and other data management and sharing policies that may affect biomedical research and the RDA community in general, and to sort of explore and try and discuss some of the best practices around, developing data management and sharing plans and how those kind of factor into culture change as well. Then I think we want to sort of, throughout the session, try and identify sort of those measures that might be needed to incentivize kind of greater data sharing in biomedical research and other research, and to sort of affect cultural change towards greater data management and sharing practices. And then last, I think the kind of bottom line for this session is to really figure out whether we need an ongoing group or a forum to sort of address these issues that might be relevant for cultural change that we either identified or that we say sort of need further discussion, and to understand whether there's a role for RDA here, either in sort of creating a new working group or an interest group, or whether some of the things we've identified and discussed might be best sort of situated, with other existing working groups. And I will just say really quickly, I have no sort of preconceived notions about what the specific outcome should be. This is really, I think, an open discussion intended to kind of figure these questions out. And luckily, the co-presenters, I think, have pretty good representation from other existing RDA working groups and interest groups. Okay, so in terms of the sort of structure for today's session, the way we're planning on doing this is to have sort of two presentations about policies, each about 10 minutes each, kind of looking at data management and sharing policies and sort of how those might relate to cultural change. First from myself, then from Jeremy Gielen at CIHR. Then we'll do about 10 minutes combined for questions and answers for sort of anything that came up, during those presentations that you might want to discuss further. Then we'll switch over and do kind of two more 10-minute presentations on sort of data sharing plans from Claudia Medeiros from Unicamp, and Tomasz Miksa from TU Wine, and then we'll do sort of a combined 10 minutes Q&A for those as well. And then I think we'll switch to having kind of a open discussion, hopefully for the rest of the session. And if we have any leftover time from the earlier sessions, we'll just add it to this as well, on sort of what role RDA might play here in kind of hosting a working group or a interest group to kind of continue this discussion and to really figure out whether there are issues that need to be taken up in a new group or can be kind of assigned out to existing groups. And in particular, really thinking about the issue of sort of cultural change and the kind of incentives that might entail. So I will go ahead then and take sort of the first presentation here, assuming I can advance my slides. There we go. Like I said earlier, I'm Taunton Payne. I'm the director of the Scientific Data Sharing Policy Division in the Office of Science Policy in the U.S. National Institutes of Health. I want to talk to you a bit today about the new NIH data management and sharing policy, and sort of what we're thinking in terms of how it kind of intersects with cultural change. So first off, when people issue or develop data management and sharing policies, I think they can really have any number of things they might be trying to achieve in them. There are two major things that I think are emphasized in the NIH data management and sharing policy that was published in October of 2020. So the first is, I think, a scientific goal of really wanting to try and advance rigorous and reproducible research by enabling validation of research results through data that are shared. There's also, I think, kind of ancillary benefits that it hopes to achieve of, really wanting to make kind of high value data sets accessible and also kind of accelerate future research directions and to sort of, increase the opportunities for citation and collaboration between researchers. But there's also, I think, public policy goals that are not necessarily scientific in nature. And certainly I don't have to tell you how over the last 20 plus months at this point, we've seen sort of concerning trends in terms of public trust in research. And so part of this policy's goal is really to try and promote public trust in research by, for example, fostering transparency and accountability in the research that we support, and also demonstrating sort of good stewardship over taxpayer funds. It's also, I think, intended to help kind of maximize research participants' contribution, and of course to kind of reaffirm, appropriate protections for research participants' data. But I don't want to give the impression that NIH has just discovered scientific data sharing or that scientific data sharing is somehow something that's new. Obviously, this is something that is kind of integral to sort of the modern concept of what is science. And I'm just showing, an example here of data that were published to support Boyle's law in 1662. So this is not obviously a new concept, but I think that there is a difference between sort of what we all understand to be essential and sort of critical and where the culture might be. So here, I think there's a pretty robust literature, showing the sort of lack of easy availability of data underlying published findings. So 350 years later, we still have a lot of work to do. And just a sort of recent paper from last year, looking at 875, or actually this year, 875 papers across 9 disciplines in nature and science over the last 20 years or so. And looking at sort of data availability statements and trying to follow up on those and actually get data that underlie those papers, they were only able to get it in about 40% of cases, and about 20% of cases were declined, and the rest they just didn't get responses. And the reasons for declining actually range from things like, well, the PI has died, or we can't find the data, or simply we don't trust you. So it's pretty clear that there is still, I think, a lot of work to do here, and that there is sort of a change in culture that is needed. And we certainly had that in mind when we went through the process of developing this policy. So it was we do normally put policies out for sort of public comment and engage the public in this and various stakeholders. But I think in this case, we definitely recognized that, a major goal of this policy was actually trying to achieve cultural change. And so as part of that, we actually engaged with them, I think, on a much higher level than we normally would. So we went out for public comment 3 different times over I think a very large, or a very long period of time. And I want to point out the policy was issued last year, but is actually not effective until January 2023 in order to try and give people time to come into compliance. We also went through a formal tribal consultation process and actually got sort of formal recommendations from an outside advisory committee to the government. So this is something that has been, I think, sort of socialized with the community in a pretty iterative fashion, and also I think reflects a lot of their sort of input. So this is really something where we have kind of built to this point. And just to say really quickly sort of what's in the policy. So, as I mentioned kind of on my first slide, those two major, things we were trying to emphasize, really the goal of this policy is to sort of foster a culture of data stewardship through stronger data sharing and data management practices. And it does this by having only sort of two basic requirements in it. So the first is that it requires the submission of a data management and sharing plan for all NIH-funded research, regardless of how much money people request or what kind of mechanism is used to support the research, that would describe how, where, and when data would be shared. And then once the plan that was actually submitted with the application for funding is approved by the part of NIH that is funding it, we would expect compliance with that plan. It would be a actual term and condition of award. And we say that, your compliance with that plan can affect future funding decisions. And it becomes effective for new awards going forward on January 25th, 2023, at which point it will actually replace an older data sharing policy we had. And we do have sort of additional kind of guidance around the policy to help people understand what we're expecting here. And so while we say there's only two kind of requirements in it, you'll note that one of them is not data sharing itself per se. It's that you have to develop a plan and then you have to follow it. But we do expect that when people are drafting their plans, that they will really approach them with the kind of default stance that they will maximize appropriate data sharing. But we do recognize, of course, that, while all scientific data should be managed, it's not necessarily possible or appropriate in all cases to share all scientific data. And so there can be certain exceptions that can be provided in plans that would limit sharing to some degree, such as for ethical, legal, or kind of technical factors. And we do say that, I think, throughout the policy that we want, sharing to be kind of responsibly implemented. And so we really expect people to outline how they're going to protect the privacy rights and confidentiality of people whose data they're talking about here, and that nothing in this policy changes the requirements to comply with existing laws, regulations, or other policies. And I think a big change, and this is kind of getting at the sort of cultural change issue, is that what we're really telling people they need to do is to prospectively plan for data management and sharing. And we're also saying this, in terms of research participants' data, that as you're planning for this, you should really be thinking how you're going to handle this in, for example, the informed consent. And we really want people also to think about sharing through sort of controlled access repositories. One of the supplemental information documents that we published alongside the policy, which also went through public comment, is a short document describing the kind of elements that should be in a data management and sharing plan, or what we would sort of recommend should be there. So it covers things like, what type of data are you going to be generating? Are there any sort of tools, software, or code that would be needed to access and use those data? What sort of standards are you going to be using to actually collect these data under? What are the sort of data preservation access and timeline? So when are they going to be made available? And for how long do you anticipate they'd be made actually available for? And then, there's a whole section on sort of access, distribution, and reuse considerations. And this is where we would really expect people to tell us if there would be any kind of limitations on secondary use. And then last, we really asked them to tell us who's going to be responsible for this plan, at the institution. And we generally say that we think those plans should be about 2 pages, not a whole lot longer than that. And then so in terms of the actual process and how this will be integrated there, I won't go into too much detail, but I'll just say it is, a fully formed plan should be submitted with the application for funding. And so that would be, as sort of early as possible in the process. It will be sort of reviewed for adequacy by NIH program staff. It will not go to peer review to be scored. But they will comment on the budget. And plans, of course, can be updated. If there's a change in the research plan, the data management and sharing plan should also reflect that as well. And as I mentioned, this will be incorporated into terms and conditions of award, and the actual compliance with the plan can affect future funding decisions. So I've talked a lot about compliance, but I think from our perspective, changing culture, there are things that NIH can do, some of which are in this policy. There are things that NIH can do to help change the culture that are not in this policy. And there are things that would be necessary to change the culture that NIH cannot necessarily do. So first off, I really think that we need to sort of see what our options are for kind of aligning incentives to make people want to do the kinds of things that the policy is expecting them to do, so that we don't have to rely so much on things like compliance measures. I do think that one area where we probably need to see a lot more work is in sort of facilitating data citation, either by enhancing findability or citability of data. But, generally speaking, with the goal of trying to make it so that people can receive appropriate recognition for their contribution when they provide data and when those data are used, and that that information can be used to help people in their careers. That is something that NIH can have some influence over, but it's ultimately, I think, something that has to also happen outside of NIH as well. And then I think also there's an interest in wanting to sort of socialize and kind of model positive behavior, because I think that's a critical component of sort of cultural change as well. So part of this is being done in the policy by really wanting to make sure that peer reviewers are seeing budgets for data management and sharing plan that actually get submitted with applications so that they can understand what is a reasonable budget look like. And the policy says that we may post data management and sharing plans publicly, and we would very much like to do this. We're still working out the details of how and what's the most appropriate way to do so. But I think that this is also something that may help to really share kind of information and help kind of model best practices of what does a good plan look like in the community. And then last, I think there's a question for us here about sort of we talk about culture change, but whose culture are we talking about? So, in general, I think in the policy, we've really meant this to be researchers, changing the sort of culture of research. But at the same time, universities also have, a very large stake here as well. And if we want to talk about being able to, enhance sort of career advancement, clearly universities have a role to play here too. And then funders, my own agency, and I think others as well, the actual process of getting this policy out and sort of implemented is one that involved cultural change, and one area where I think we probably need to continue to work to make sure that our own internal culture sort of reflects where we are trying to go with this policy. So I will stop there, and I will turn it over to Jeremy. So Jeremy, I'm going to stop sharing.
Okay, thank you, Tauntaun. Just have to pull up my slides. Okay. Okay, I trust you can all see those. Hi, everybody. I'm Jeremy Gielan. I'm a senior advisor at the Canadian Institutes of Health Research, Science Policy Branch. Very, very pleased to be speaking to you today. I'd like to begin by acknowledging that I'm giving this presentation from Ottawa, which is the traditional unceded territory of the Algonquin Anishinaabe peoples. So I'm here today to talk to you about the Tri-Agency Research Data Management Policy. To start, I just wanted to clarify for the audience, because it includes many folks outside of Canada, what is meant by tri-agency. So the Canadian Institutes of Health Research, the Natural Sciences and Engineering Research Council of Canada, and the Social Sciences and Humanities Research Council of Canada are three federal granting agencies in Canada. And when they work in collaboration, whether that's on programming or policy or any other type of initiative, it's typically referred to as a tri-agency initiative. So a tri-agency program, in this sense, or in this case, it's a tri-agency policy. So it applies across all three agencies. So this is the Tri-Agency Research Data Management Policy. So each agency has done certain work and so on research data management, policies, practices, and so on. But it was really in 2013 when the three agencies started working together to develop a tri-agency research data management policy. And that's when we launched a consultation document called Capitalizing on Big Data towards a Policy Framework for Advancing Digital Scholarship in Canada. And one of the real objectives of this exercise in 2015 was to receive, opinions, suggestions from the community on what agencies could do to advance digital research, specifically in the policy area. So building on input we exercise, we developed a document called the Tri-Agency Statement of Principles on Digital Data Management. After a round of consultation, we released that in 2016. And what this document does is really lays out the agency's expectations for research data management, as well as the roles and responsibilities of various actors in the research ecosystem in Canada. So the roles and responsibilities of funders, institutions, scholarly associations, and researchers, as those roles and responsibilities pertain to research data management and sharing. This document doesn't include any mandatory requirements. Rather, we developed it as a way to essentially set the stage for developing a mandatory policy. And so following our release of that document in 2016, we set about to develop a mandatory research data management policy. We started consultations and engagement on that in 2017. And then in 2021, after delaying the policy launch for a year because of COVID, we released the Tri-Agency Research Data Management Policy. So that policy has 3 requirements, one focused on institutions, the other 2 focused on grant holders. So the first requirement, focused on institutions, is that each post-secondary institution and research hospital eligible to administer CIHR, NSERC, or SSHRC funds is required to create an institutional research data management strategy and notify the agencies when it has been completed. The second requirement is a data management plan requirement, and this is that for certain funding opportunities, the agencies will require DMPs to be submitted to the appropriate agency at the time of application, as outlined in the BoF proposals. And the third requirement is a deposit requirement, and this is that grant recipients are required to deposit into a digital repository all digital research data, metadata, and code that directly support the research conclusions in journal publications and preprints that arise from agency-supported research. I did want to also point out what the policy says about Indigenous research data management. The agency's acknowledgement of the importance of Indigenous RDM is woven throughout the policy. For example, in the preamble and so on, we affirm, the right to Indigenous data sovereignty, research data sovereignty. But I wanted to focus in on what's said about Indigenous RDM in the 3 requirements specifically. So with respect to institutional strategies, the policy says that the agencies recognize that data created in the context of research by and with First Nation, Métis, and Inuit communities, collectives, and organizations must be managed according to principles developed and approved by those communities, organizations, and in partnership with them. With respect to DMPs, DMPs must be co-developed with First Nation, Métis, and Inuit communities, collectives, and organizations in accordance with the RDM principles or DMP formats that those communities accept. And finally, with respect to data deposit, any research that's conducted by and with First Nations, Métis, and Inuit communities, collectives, and organizations, those communities will guide and ultimately determine how the data are collected, used, and preserved, and have the right to repatriate the data. And notably, this could result in exceptions to the data deposit requirement. So for example, if the community that in question does not want to deposit the data, it has the right to make that decision. So I just wanted to spend a few minutes focusing in on the requirements themselves. With respect to institutional strategies, the agencies will review the strategies, but we will not evaluate them. We recognize that, institutions have particular and differing circumstances, with respect to their size, their research reflect in the plans that they develop. However, the policy does say that all strategies should include certain items, such as recognizing data as an important research output, details on how researchers will be supported on how to properly manage data, a commitment to the adoption of established best practices when developing institutional standards or policies for data management planning. And finally, strategies should include details on how the institution will provide or support access to repository services or other platforms. With respect to the DMP requirement, the policy itself doesn't require or even recommend the use of any particular DMP format or tool. That's not to say that the agencies might not do that as they implement the requirement into their funding programs, but the policy itself doesn't include anything along those lines. But it does note that DMPs are living documents that can be modified to accommodate changes throughout the course of a research project. And while noting that the content and length of DMPs depend on the research project, it does note items that all DMPs should include and describe. So for example, how data will be collected, documented, formatted, protected, and preserved, how existing data sets will be used and what new data will be created, where data will be deposited and whether and how data will be shared, responsibilities of team members and data curators or data generators and so on, and succession plans for when team members leave and whatnot. And finally, a DMP should include details on ethical, legal, and commercial constraints. Finally, moving on to the third requirement, the data deposit requirement, it's worth noting that the policy does not require researchers to share their data. They are required to deposit it, not to share it. However, the policy does note that the agencies expect researchers to provide appropriate access to the data where ethical, cultural, legal, and commercial requirements allow, and in accordance with the FAIR principles and the standards of their disciplines. And the deposit of the data, the metadata code, should be made at publication, linked to the publication with a persistent digital identifier. The agencies are pursuing a phased implementation timeline for the strategy. By March 1st, 2023, post-secondary institutions and research hospitals must have developed and posted their RDM strategies. By spring 2022, the agencies will identify the initial set of funding opportunities subject to the DMP requirement. And then as for the deposit requirement, we're still in discussions with the Canadian research community on when and how to implement that feature of the policy. And I should note that the institutional strategies will be quite helpful in helping us determine the timeline for that. So I just wanted to leave it there. The agencies are currently working on determining the initial funding opportunities that will require the DMP, as well as what the submission and assessment processes might look like. But to conclude, I just wanted to direct you to the website science.gc.ca, particularly the section on interagency research funding and policies and guidelines. That's where you can find not only the tri-agency research data management policy, but also the a consultation summary on the outreach we did, and the even earlier document that I mentioned, the 2016 Statement of Principles on digital data management. So I will stop sharing my screen now. Thank you very much for your attendance and listening to my presentation. Whoops, sorry. There we go. Okay.
Great, thank you, Jeremy. Well, so I think, at this point we have about 10 minutes for questions on sort of either of these presentations or the topics that came up here. And feel free to post them in the chat or to raise your hand or whatever. I don't think we have any sort of preconceived notions about how best to do this. Okay, I see one from Anne. Oh, I think we're, I'm not sure we're able to hear you. Can others hear her?
Can you hear me now?
Yes.
Yeah, okay. The question is about the policy in Canada, which targets the data that are linked or have been used for a publication. And I was wondering if there is a policy for the data produced that are not necessarily used in a publication, but could be of use for other researchers or for any topic.
The quick answer is no, at least not in the context of this policy. And I should note that this was an issue that we discussed a good deal during our consultations and our engagement and so on. It was, this issue of, determining which data are really relevant to a publication was a difficult one. So we finally landed on, the phrasing, directly, how did I say it there? Directly support the research publication. And even there, there could be some ambiguity. So we also are, relying too on researchers' judgment and the standards of the particular community in question to determine what those data are. But also noting that, in various instances, the data that might not be directly supporting the publication is still very useful. But in the context of this policy and as a first step, we just had to limit things in such a way that it was just framed as the data that directly support the publication.
Thank you.
Claudia?
I don't know if I may ask a question, but it's, I'm asking a question to Jeremy and Taunton, which is a continuation of Anne's question. Because right here, I'm having people who say they do not want to share the data because the data supports the publication. And since the publication is under embargo, the data cannot be shared. So I tell them they are separate things. But then someone came and told me the following. My paper has a table, okay? So, and this is a figure within the paper. Therefore, if the paper is under embargo, the figure in the paper is under embargo, and I cannot publish the table. It's the table is just an excerpt of a huge table. Of course, it's not the entire table. So have you come up with this kind of a reasoning to, from my point of view, avoiding all the curation that the data requires? Thank you.
Jeremy, do you want to take it first?
You can go ahead, Taunton.
Great. So in the new NIH data management and sharing policy, we don't, I don't think we've sort of specifically addressed the issue of embargo yet, either for when a publication is under embargo and the data underlying it would have to be shared by a certain point, or when in those cases where people might be interested in putting embargo on data sort of directly itself. What we do say is that in terms of our timeline, we would expect data to be shared no later than the time of the publication of the findings, or by the end of the award if the data have not been the subject of a publication yet. And that includes things like sort of null results. but we have not, I think, yet offered a level of detail in terms of guidance around whether sharing would necessarily also, permit people to technically share, but to have an embargo on, say, publications arising from the result or from the use of those data. We have, I think, in the past had policies and certainly repositories operated out of NIH that have permitted people to do things like that, where to really try and encourage people to get things to share as absolutely early as possible, like under the NIH genomic data sharing policy. We at one time allowed people to submit, data well in advance of publication, and then tried to sort of enforce the same embargo terms on the use of the data set, such that people could have access to it and could use it, but simply could not publish until a certain time. That, I think, in practice was very challenging to actually implement. But I think, to the point, we have not yet offered, I think, a view on whether that would be sort of permitted under this policy or not.
Yeah, I don't. Yeah, thanks, Taunton. With respect to Canada, yeah, I mean, those a lot of those particularities aren't included in the policy itself. But I should note that, I mean, this broader question of practices is certainly something that could be worth discussing. And because, I mean, a policy typically can only include so much. And, but with respect to what, all the various publishing practices and how researchers may share their data or not, I mean, that's a question of culture change, which I think policies can support, but not always explicitly speak to. I mean, sometimes they can. But so for example, many funders internationally have required that data pertaining to COVID publications and so on be shared. And there's various ways that researchers have gone about doing that, or not doing it. So it could be including or posting the DOI in the data availability statement, or in supplementary materials, and this wide array of means by which people are providing access to their data, or kind of developing reasons for why the data can't be shared or not yet. I mean, this is to my mind certainly a question of culture change that it is really worthwhile thinking, like what are the different types of mechanisms and incentives that can be used to address it.
Yeah, I would have to agree with that. That kind of assessment of the kind of role of cultural change here. I mean, I think we also think about this in terms of sort of those two goals that I articulated for the policy, and sort of advancing the sort of rigor and the reproducibility of the research we support, as well as the sort of public trust issue as well. And so I think in every situation where we're trying to work out sort of what is the exact thing that the policy is going to permit, we're always, I think, going to try and kind of default to that, and to the policy's goal of trying to make sure that we're really kind of advancing a cultural change, towards practices that facilitate those two things.
Hi, this is Jenny. I don't know how to raise my hand. I put a comment in the chat as well. I'm thinking of this conversation also as how to connect other stakeholders. So there are a lot of really useful conversations going on across the publishing community. They often have strong linkages with both the data librarians at institutions as well as repositories. Glad to see Anna here. I guess the other thing I'd like to call out, the other major stakeholder, is the role of, I'll just call it the biotech industry, and ensuring that the data that comes out of their machines, their analyses, are as shareable as possible. There are examples of that being done, because if the data that is generated at the time it's generated is difficult to share, then you're asking people to throw inefficiently a lot of resources into making it more readily shared. So that's just looking at the larger sense of changing the mindset and making sure if what you're trying to do is a cultural change, don't just heap it all on the poor PI. This isn't, I mean, it is and isn't their day job. It sort of is, but if you make it an onerous day job, they're gonna do their best to avoid it.
Yeah, and Jenny, I think that gets at the question of sort of the cultural change of who, that we can't really, you know, just be talking also about the publicly funded research enterprise as well.
Yeah, and if I might also add, you know, it also speaks to, I mean, kind of particular interventions and mechanisms that stakeholders have to, you know, develop and adopt to really drive culture change. So, for example, this is a little bit, I think, away from the example that you gave, Jenny. But you know, Tonton, on your slide, you mentioned kind of like acknowledgement and so on, and citation practices. I mean, that's certainly something that I think is worth thinking about. But maybe something that gets a little bit more to the example with the biotech industry and so on. You know, the ease by which data can be shared. You know, I personally think that you know, stakeholders are going to have to think a little bit more about probably metadata schema and what they're recommending or requiring that you know, in a funder's case that their grant holders are using. You know, ideally, if we did kind of take that route, whatever schema we were recommending or requiring or what have you, or deposit in certain repositories, I mean, this other stakeholders would be kind of aligned with the approach that we were taking.
Yeah, that's an excellent point. And thank you for raising these questions. Okay, well, so I think we need to move on to our next set of presentations. So Claudia, are you ready to go into the next one?
Yes, just a second. Okay, let me share my screen. Here and here and here and here. Can you see my screen?
Yes.
Yes.
Okay, so this is a heavily charged logo initial slide that's just to tell you a little bit about the many hats I'll be wearing during this 10-minute presentation, because first of all, I am a researcher at the Institute of Computing, which is the logo of the Institute, University of Campinas, and this is my lab that deals with multidisciplinary research involving data. Then I'm also the coordinator of the University Scientific Data Management Committee, which is quite new. It's 1 year old, okay, and it's probably a full-time job. And also, I am part of the coordination of a very big funder in Brazil, coordination of its program on science and data science. And I'll talk more about FAPESP later on, but I'm also a member of the RDA Council. Oh my God, it's written countly, and which in a way is behind lots of what I'm going to talk about. So directions forward absolutely involve RDA. Not because I'm saying this, not because I'm a member of the council, okay, but I see the advantages of involving RDA and participating in the RDA culture and environment. So I'd like to thank Taunton, NIH, and RDA. And I'd like to say that I'm going to call this presentation not only data sharing and evolving practices, but the good, the bad, and the ugly, and which are all related to DMPs and data sharing culture. So let's start with the good, which the two presenters before me talked a lot about concerning collaboration through open data or open metadata when the data cannot be shared. And this figure illustrate what's behind, which is through repositories, people share, okay? So it's cooperation through data reuse, and data is an enabler of collaboration without barriers. This is very easy to say and very hard to achieve. So how to work towards this goal? Through DMPs, because DMPs plan how, among other things, okay? When you write DMPs, or when people write DMPs, they have to think about sharing, not only with others, but with themselves in the future. And even those, and I received lots of feedback and talked to lots of scientists about the hardships of writing a DMP, which is something quite new here in Brazil. And one of the most common remarks is that writing a DMP makes people think of data, or think data, not as a mere support of one's research, but as something that enables research and the ways you have to manage data, which seems obvious, but all of the issues associated with DMP raise new questions and help change culture. Oh, I never thought of that. Okay, this has been prompted by writing DMPs. So in 2017, the FAPESP, Fundação de Amparo à Pesquisa do Estado de São Paulo, decided to implement its first data management policy, enforcing compulsory DMPs to a very large set of proposals upon proposal. Okay, so FAPESP receives an average of 25,000 proposals per year. And when this policy started, it affected directly about 400 proposals a year for bigger projects. But of course, if you expect people to write and prepare a DMP, there must be repositories and infrastructure available, which did not exist at the time, okay? Not in an institutional way. So at the same time this policy was created, FAPESP also created a working group of 7 public universities in the state of São Paulo to establish a network of research data repositories. And I coordinated this working group. And why do I place RDA here? That was before I became a council member. And that's because we were able to accelerate the process with the help of RDA, including advice on data management policies. And as a result, this Federation of Repositories was inaugurated. By the end of 2019, I'm responsible for coordinating this one in my university. And it's created a very interesting side effect. First of all, because it was designed to be open, early in June, we were able to add a very big COVID data repository to it, which continues growing, and it's feeding lots of proposals. But this created also a kind of a virtuous cycle, DMP funder, researcher, institution. First of all, DMP enforcement prompted institutions to create repositories. Okay, so there were institutional changes, both in infrastructure, but in policies. Second, because they had to write DMPs and had to specify where their data would be made available or stored or managed, researchers started requesting institutional support, which made institutions improve their services. So DMPs are, they are acting as a prompter of culture change, okay? And third, DMP introduction prompted the funder, in the case FAPESP, to change policies. And it introduced culture change. It's introducing culture change within the funder. And other funders in Brazil are following suit, starting by DMPs. So this is a kind of, I don't know, a seed for culture change to make people work differently, even though I must confess, there are still lots of researchers who say this is useless bureaucracy until their halfway reports are checked by reviewers who will verify if they are following the DMP. And if they are not, funds are withheld until they explain what is happening. Okay, so this is the actual policy here. Then, so this was the good. DMPs as a prompter of culture change, okay, and policies, institutions, whatever. The bad is something that is not really mentioned, is that when you plan data sharing, we always talk about researchers, but it involves institutions. Around 6 months ago, because FAPESP also has called for funding the creation of big research centers, okay? 10-year funding, multi-million-dollar proposals. And what kind of DMP should these proposals have? So I contacted via RDA several funders and asked them, when you are funding a new research center, what are the DMP requirements for the research center? And no one had such a requirement. They showed me lots of lines of things that could be added. So I had to kind of improvise and create a DMP as part of the proposal to create a new research center. Okay. And also when we think about sharing and reusing, so why would this be the bad side? The bad side is that because it requires thinking multiple policies within a DMP. When you are writing your DMP, you are thinking about sharing, oh, maybe with other people, but you're not thinking about side effects of institutional sharing. You are not thinking about side effects of multi-country sharing. Okay, so, and these are all different facets of a DMP. And then we come to a researcher fear, which is reuse. Okay, so I like the slide which was given to me by Lance Waller in the States, a bioresearcher, who shows reuse as reusing pieces to create something big. But there's the different kind of reuse in which the final result is not what the pieces were created for. And this, when researchers talk about reuse and sharing, they are fine with reusing for the original purpose. Reusing for other purposes, even when writing a DMP, is people do not really think about it and they are afraid of that. So as an example, our COVID clinical data repository has been used to create papers and research around COVID. But combined with socioeconomic data, it's guiding school schedules, when to reopen a school, when to reopen services. This is an unexpected side effect, but it's still beneficial. So the first is a guitar, the second is a collage. What kinds of collage will come and how can you plan for other kinds of reuse? And finally, we come to the ugly, okay, which you've already talked about, or maybe you exaggerate calling it the ugly, okay, the negative, which are implementation, legal, and cultural issues, which block, in a sense, DMP's enactment and data sharing. Oops, sorry. There you go. So first of all, writing a DMP is hard. Everybody knows that. The first DMP is hard, the second, you have to think a lot, and people don't realize that. Within the DMP, there's the preparing for reuse, which is also hard. Managing repositories is hard and expensive. This goes beyond DMP, but if you are thinking about institutional DMPs, you have to think of that as well, the costs involved. So there is a technical issue, but there's the interoperability cultural issue, which is also multi-layer of cultural changes and domain specificity. And this is my almost last slide, okay? So when I talk to people who are preparing their DMPs and writing, I will not share in the DMP. What are the reasons invoked? First, my data will be stolen and monetized by people who are able to process it faster, combine it faster, and namely, the South, I should not say it like that, but South and North, okay? Second, fear that this will increase the digital divide of those who have enough resources to share data with those who don't. Second, data protection laws. The GDPR, LGPD is the Brazilian law, valid as of last October. POPI is a South African, July this year. First of all, people write in their DMPs, I'm saying things that I have seen. I will not share my data because I'm afraid of breaking the law. They do not say I'm afraid, but I may be breaking the data protection law, okay? And as a consequence, quite a few open data resources, including health resources, are being closed, at least in Brazil, because people do not know how to deal with the law. And there was a question that I asked about open access, publishing, copyright, and data. And some of the issues arising about open access or publication embargo is that people claim they have no right to publish data because of publication embargo. I've talked to several publishers, in particular Springer and Elsevier, and they say there is no such problem with data sharing, even if underlying a publication or linked to a publication. But then people have come up with this, my figure has data and what should I do about it? So I'd like to thank you a lot. I leave you with a few questions and comments on the good, the bad, and the ugly. And thank you so much, okay?
Great, thank you so much, Claudia. I think we're going to go to Tomasz now.
Mm-hmm.
Yes, I'm just starting sharing my screen. Give me a second. Okay, right. You should be seeing my screen right now. So one more thing. Too many screens. Okay, good. So thank you very much for the invitation to this exciting session. My name is Tomasz Mica, and I'm here as a co-chair of two groups at LDA, of DMP Common Standards Working Group and also the Active DMPs Interest Group. And outside of LDA, I'm a senior scientist at the Technical University in Vienna, in Austria. And today I want to talk about fostering cultural change, and I'm going to use an example of machine actionable data management plans, something that we have been working at LDA in our working group. And in my presentation, I'm going to quickly tell what we did, but basically I don't want to sell to you and say that MADMPs are going to change everything, but rather to show the approach we have taken as the working group as how we questioned many things that seem to be given to us and that we could have taken for granted, and how I believe we are trying to drive the cultural change in data sharing with the use of MA-DMPs. So that's at least the plan for me. Okay, so something that has been already explained by the previous speaker is that the data management plans are very often considered by researchers as a bureaucracy, and that they are created too late when they have to hand in a project proposal and have to quickly hack something together. And most of them complain that they have to fill out lengthy forms with different types of information on things like technical aspects, legal aspects, and they are not experts in that. And this was one of the problems we have identified. But the next problem we also realized is that you have a researcher who has this plenty of different tools. You can have a DMP online for filling out the DMP. You can have a registry of repositories. You can use specific identifiers. But the problem is, how do you discover these tools? How do you know which one to use? And do I need to use all of them or only some of them? And then they also describe things in DMPs that actually have effect on other stakeholders, on other systems. So they, for example, can say, I'm going to deposit this 50 terabytes of data at the infrastructure of my university. And then somebody at the university is surprised, really? You haven't talked to me. So that's the second plan we have identified at the beginning. And we made this assumption, a hypothesis, that basically people are willing to help and are willing to collaborate as long as you have the right timing and you have the information flow. So if you contact the research support early enough, they can tell you on what is feasible. If you talk to your technician early enough, he is happy to contribute. So we must do something to improve this information flow, and DMPs can be this way to exchange the information. So some of the stakeholders can provide the information, and some other stakeholders can consume this information. And what we mostly observe so far, as the DMPs are driven by the funders, is that it's usually perceived that it's a researcher delivering some information to the funder, and that's it. And we wanted to change this a bit. And here it's a workflow that we have used conceptually to depict typical steps of a researcher writing a DMP. And they have things like specifying types of data, and this is the only thing that can come from the researcher. And then you have things like costs, storage, licensing, and so on. And here's a potential to include other stakeholders. So we can have the infrastructure operators, we can have the research support, as I mentioned, and we can either include them directly or using the systems that are acting on behalf of them. And when I say acting on behalf of them, I have here always the same example of license. Many of the researchers don't care about the license. If there is somebody who can recommend them the default license, they will just use it. And if you are a special case, you usually know that you're special and you need something else. So this kind of automation, this kind of information flow. And in the working group, we identified that we need to have three things for this. We need to have a common data model to exchange the information. We must have these well-defined workflows. So we have to know who is responsible for what. And we must have a data infrastructure. And the focus of RDA was defining this common data model, which resulted in a recommendation. So we have the recommendation, it's a 2-pager plus a documentation. It's not a question, it's not a template, but it's rather a common way to exchange this information. It provides a minimum common set of things. So we didn't try to really map all the possible funder templates. It wouldn't be possible. We wouldn't be able to fulfill all the requirements. But now, as you know, what we did, what is the assumptions, what are the problems I've identified? Let me focus on 3 more slides on fostering the cultural change. So we believe that to change the culture of sharing the data, the DMPs or MA-DMPs must bring benefits to all stakeholders. So the information that is requested in the DMP must be consumed by someone, must be used. It cannot be only asked for the sake of asking. And we have found in many templates that questions are asked because it's nice to ask such a question. And we made some community consultations. We asked different stakeholders, what information could you provide and what information would you expect? So maybe it would be good, again, to go back and ask these stakeholders, what do you need, what helps you in data sharing, and not just trying to make it fit to what we have currently in the landscape. The next crucial thing I see is the automation, and this is what we always had behind in our heads, is we have to reduce the manual effort, because as long as we ask people to fill out the same information all over again and report the publications of data sets for a repository system, for a DMP, for a CRIS system, for something else, they will be angry. So we see the DMPs as a way to enable this integration between the services and as a glue. So if somebody, for example, uploads a data set into a data repository, there should be an easy way to add this data set to a data management plan and simply update the data management plan. If you, for example, have all your data in ORCID or in any CRIS system, information on the project, on your affiliation, on the size of your shoe, this should all go automatically to the DMP. Such little enhancements can change the way people perceive the data management plans and whether they consider it useful or not. And in our group, we focused only on modeling the information. And we have also written up 10 principles for MADMPs, which consists of 10 principles. And the common model is only one of the principles. So we know that the cultural change, or in general, improving the attitude towards the DMPs won't happen because of a single recommendation, single policy, single guideline. We need a mixture of approaches. And the lessons learned, if I had to summarize this in one slide, I would give 3. It may be necessary to question the status quo. So the status quo is, for example, pleasing the funders, but maybe we should think also about other stakeholders. We should not try to include all possible templates, and maybe there are some movements now to try to synchronize and to agree on a common set of questions to ask. The second lesson I would say is that some elements enabling the change may not yet exist. So there may be something that we are missing, and there is a proverb in Polish, and I'm Polish, just stirring the tea doesn't make it sweeter. You need to add sugar. So if we try to use existing components and I just try to rearrange them, we won't make the change. Maybe we have to come up with something completely new. Maybe we have to come up with a service that doesn't exist yet. And it takes time to make the change. So I remember when we were starting the working group 3-4 years ago, we had to explain a lot on why this is needed. And now I think people are on the same page and are rather thinking of services and how to actually apply what we've been discussing for the years. And in case the topics of what we are discussing today should be brought to some working groups, interest groups, here are some suggestions where these discussions could fit, especially I think the interest group on DMPs could be a fit for having similar discussions as we are having right now on the future and direction of data management plans. Thank you very much, and looking forward to your questions and your feedback.
Great, thank you. Well, we're a little bit behind, so I think we have time for maybe 1 or 2 questions on this before we kind of jump into the open, discussion at the end, just to make sure we have, sort of time for that. So, would anybody like to raise anything about Claudia or Tomáš's presentations, or any of the sort of topics we touched on there?
If I have time, I'd like to ask Tomáš about the ease of automation. Okay, because I found this claim that automation will help culture change. This is really nice. But on the other hand, it may involve lots of work. So can you give me, I don't know, some hints or remarks?
Well, we've been doing some checks on to what extent we can automate, for example, how can we support reviewers? And we found that I think roughly 60% of the typical contents of a DMP, we are able to identify and present in a nice way to quickly see what has been answered or not. We can do some validation, but there is still 40%, which is completely a matter of the human readable narrative. And you still need a human to interpret it, and you cannot automate it. But this is, I would say, a trade-off with in any case for automation that we are trying to reduce. 40% improvement would still be pretty good, I would say. And yeah, a lot depends on the specific use case that you're thinking of.
Yeah, of course. Yeah. I don't know. Would it apply to all domains? Theoretically, right?
We haven't found any clear use case where it wouldn't. Yeah.
Okay.
So one assumption we are making and having, which may be also different, is that we talk a lot to the DMP tool providers, and in the past there was a tendency that there is one central DMP tool that everyone, for example, in the world or in a country can use. But then such a tool doesn't know much about the person using the tool, and it's very hard to import the information. So what we are currently suggesting is that these tools are deployed closer to the end users. So for example, at the universities where more information, more context exists, and more can be pre-filled automatically.
And I see we have one question from Marta in the chat, if you want to try and get to that.
Tomasz, I love the idea of linking DMPs and shared data, but what impact do you think it will have on how researchers engage with the plans and data sharing? So the first thing I would say, in the first step, we want to get rid of the negative emotions. So we want to make sure that they stop hating it. And then if we think about the novel use cases, one of them we've been considering is, for example, sharing of DMPs, having a repository of DMPs. And if you do it right now with traditional DMPs, the only thing you can look for is give me a DMP of a specific person, or a DMP containing specific keywords in the title. Not very exciting. But if we were able, for example, to look for projects which have been using the same data sets, so basically doing kind of exploration, kind of not a literature review, but rather data review, or give me projects which were using the similar technologies, had similar security considerations, then this may be a very useful way for researchers to learn how others approached a similar problem. And this is where I would see one of the benefits for them. So you share your DMP and you'll benefit from others sharing the DMP.
Great. Okay, thank you so much. So I think at this point we should probably jump to our sort of open discussion session. And I think what we really want to think about, for this is really, in light of what we've just discussed. So we've talked about two different policies. We've talked about, and really, I guess you could say we've actually talked about more than that, because it was touched on also, in Claudia's presentation as well. And in light of the kind of different, expectations for plans that we're talking about, on some level, it seems like what we're moving towards is a lot more expectations being placed on researchers by funders and potentially from other sources as well. So perhaps much greater coverage, in the community in terms of exposure to requirements to share data, to develop data management and sharing plans. And I think there are a number of areas that people also mentioned where we are perhaps not changing things either through policies or through plans per se. So I'm just wondering if it makes sense to kind of spend some time talking about what some of these other measures might be that would be needed to sort of incentivize cultural change. certainly I think what we're hearing also, thinking about the sort of conversation around the first couple of presentations too, is that it's not enough simply to sort of put things on the funders and to have the funders kind of use their levers, which may be considerable, to sort of push everything. So I'm wondering if maybe we can dwell on that a little bit and see what specific measures do we think it is that need to be considered kind of beyond the funders in order to achieve the kind of cultural change that we're talking about.
If I may, because well, of course, I'm talking from Brazil's point of view, in which everything is very regulated in terms of merit and recognizing merit. Okay, so it's all of it, all in all, is based on publications. Okay, and it does not, an institution cannot do much because it's up to the rules defined by the Ministry of Education and the Ministry of Science and Technology to start saying that they will give, for instance, more money to institutions that can show that, for instance, data sharing is practiced. By the same token, it's still very hard to convince researchers, because there is no incentive to do that they should spend their valuable time in preparing data for sharing. And it's not a funder issue. It's an institutional issue. It's a cultural issue. It's not just funders. Okay, because the funders will, okay, I'll give you grant, but if there is no recognition from scientific academies, I'm just mentioning other colleagues. Okay, why should you, you'll say you are wasting your time. Okay, I've published 20 papers and you've spent 5 years preparing data so I can publish more papers, more the fool you. I'm exaggerating, but I'm talking about incentives. But let me stop because we want to hear people.
Maybe I'll just jump in with something of a reflection. On the question of incentives, I sometimes wonder if we're operating under a presumption that publications and data are basically analogous in terms of the role they play in a researcher's career, or their worth in a way. Whereas, I think often data sets are much more like researchers regard them as much more fundamental to their future career success than any kind of particular publication. And what I mean by that, it just kind of gets back to these issues of, releasing a data set and have people benefit off it in a way that ultimately means that they are able to reach some kind of conclusion or finding before you are, and so on. And because of this, I'm quite interested in, ways that the research community, and this certainly goes beyond funders, and funders probably aren't even really the main player in this, in trying to kind of revise approaches to authorship and acknowledgement. I don't know how to, a data set can be a real goldmine, right? How to kind of incentivize sharing such a data set when it could be so useful in a researcher's future career. I'm not quite sure how to address that. It's certainly a question of broader culture. I'm not quite sure how to figure out that acknowledgement, but I think it's something that has to be, worked out.
And it sort of seems to me that there's kind of multiple aspects of that problem, right? So data citation is necessary but not sufficient in order to achieve that. But then you also have to, at the other end of that, have people actually looking at those, at that information and making decisions that, yes, this is valuable, or, ranking things. So I guess, and just trying to be mindful partly of our time, but to put it rather bluntly, I mean, do you think that, in that set of problems, that there is an RDA group that is looking at or is thinking about the issue of sort of data citation, particularly with the issue of kind of career advancement and, wanting to get appropriate recognition for people, thinking about the issue of data citation that way, or sort of about like appropriate professional recognition as well?
And Anne has asked a question, and Amy lifted her hand.
Sure. And just to respond really quickly, I think at like NIH, we certainly do have some FOAs that are for people who are purely
Oh,
access.
I'm sorry, for the recording's sake, could you repeat the question?
Oh, sure. I'm sorry. So Anne asked a question about whether there are funding calls that are targeted at projects that only reuse data, and I think they are probably not that common, but certainly they do exist at NIH.
Mm-hmm. And just talking a little bit about cultural divides and country divides, I participate in designing multi-country calls. Okay, and in some of these calls, non-Latin countries say they do not want to place more money into creating repositories because they have already funded lots of repositories in previous calls, and they just want to foster data reuse. Whereas Latin countries do not have this culture yet. You see, so we do need to foster data reuse through calls that fund the creation of repositories, only this is not seen as research. So it's non-fundable. But that's to complement Anne's question.
Amy, do you want to ask your question?
Thank you. I just wanted to respond to your question, Tonton, about whether or not there's a group at RDA looking at incentivization of data sharing, data publication, especially as related to data citation. I don't think there is one at RDA, but there are these conversations going on in other pockets, certainly, particularly within the US, but this might be a fruitful area of conversation. Should this group develop further into an established interest group, this could be a spin-off focus group type thing, pulling together people internationally, globally, who are interested in rethinking about how incentivization can be reformed, perhaps using efforts that already exist in other places to build on this topic, especially with regard to research data itself, as well as the other products that are related to research data. So not just the data sets themselves, but also the software or algorithms or models that are shared with that. And in that, you could partner with some of the other groups around software sharing, software citation, things like that. So I think there's some potential for these conversations to occur more broadly at RDA. Thank you.
That's a great point. Thank you. Anne, did you have a question you wanted to ask?
Yeah, it was related to the same point, because the SHARC interest group, SHARC means sharing rewards and credits. I am one of the co-leaders of this RDA interest group, is actually addressing not only the citation aspect, because this is not a very technically oriented group, more policy and surveys and the issue, the main issue, and we are working on that, although we don't have a session in this plenary, is around the incentives and in different countries and what work and what does not work. Mm-hmm. That's what we are exploring for the moment. So I think that regarding this question of working on incentives, the SHARC interest group at least is addressing part of it. Mm-hmm. That's the core of the group.
Great. Okay, so maybe we need to sort of take a closer look at that after this session to see what sort of components might kind of line up there.
Yeah. Okay. That's also why I followed this session, because having the shark interest group in mind.
Tomasz, do you want to make your point?
Yeah, I just wanted to say that whenever, so I'm talking now as a researcher, so whenever we are judged on the scientific quality of what we are doing, for example, when writing a proposal, we always must include the list of publications, and we are never asked to include the list of data sets, code repositories, or anything like this. And I'm not sure if only upgrading the importance of data is enough, whether we should actually downgrade the importance of publications at the same time. So I have a feeling like this is, I'm not sure if it's a really good analogy, but like with the gender equality, there are sometimes the position only for women because you want to break the fact that these positions have been taken for the last 100 years by males only. And if we want to break that the publications only count and nothing else counts, maybe we should exclude the publications from the evaluation and focus only on the other research artifacts. But that's just the idea I got right now.
May I for 2 seconds more, because I tend to overspeak. The Brazilian Academy of Sciences is going heavily towards open science. And because of that, this year, for the first time, it changed its forms for membership, not application. People have to be recommended by others. And this form is based on what are the 5 major achievements, which can be anything this person has done throughout his or her career, and what kind of support to prove that. And I was part of the evaluation team, and there were already some in which one of the major achievements was providing curated data. But then they put publications that supported that. But anyways, this is prompting something in the direction that you were talking about.
So in our last couple minutes, let me just put out one last call to see if there's anything else here that people think that either we touched on today or did not touch on today, that would be really important to think about for sort of driving cultural change forward, so that we can, maybe get kind of a sense of whether this is something where there's already kind of progress being made at RDA, or whether there's kind of a fruitful area for us to be thinking about here.
May I compliment? Well, here I go again. This was a session that longitudinal cohorts, yes, but this was a session that was prompted by the real need of health-related funders, right? Should we concentrate on health-related issues, or because this can go beyond medical data, right? It can be social sciences, environmental data, biodiversity data. So are there any limits?
Right, and I mean, I think, we're obviously coming at this from a biomedical funder perspective, which is where, we see that there is some need for cultural change, but it could be that this is so sufficiently shared across, different fields that there's no need to kind of limit it in this way. So, I guess we're sort of interested in this group's impressions about whether we think that, it's sufficiently different for biomedical research or for research involving, human data, that warrants its own group, or whether we can think about, just existing groups kind of as they are, that are sort of transdisciplinary.
I have a comment. So it's hard for me to bring something really constructive to that, but I attended RDA for multiple sessions, multiple plenaries, and participated in many groups. I feel very isolated in the groups that deal with other disciplines. I don't know what it is. Are our problems so specific or what? It just, nothing else speaks to my heart as much as this one. Yeah, it's really hard for me to define whether it's a matter of people having really similar problems and cultural problems are the same. I know, but when I'm sitting at the Earth Science group session, it feels very different. I don't feel that I can contribute, and the issues that they are discussing are kind of different, and yeah, not really relevant. One other thing is that, at least in US, from my understanding, projects that are funded by NSF are often funded to generate data sets. I know this for sure that this is the case in astronomy. So for them, it's a almost solved issue. They're paid to generate this data. In our case, it's not so.
I think that's a great point. Yeah, Jeremy, go ahead.
Sorry for cutting you off there, Maria, yeah, I think you make a really good point. And for example, you know, Tonton, you like on your slide where you had some questions and so on, you included some issues that seem quite specific to biomedical and health research. But you know, the nature of discussion just kind of gravitated towards these issues that appear to be shared like across the board. And I think that that might be something that's you know, that you find like kind of throughout the RDA, that you know, specific kind of communities and research areas, or at least, you know, the funder perspective, sometimes there are really specific issues like with respect to health data and so on, but often in kind of groups of funders and so on, and many other groups, they kind of, those kind of really specific challenges just get, I mean, the discussion moves to more kind of general issues. So there really could be an opportunity and a place for having a group that really focuses on issues that are, you know, that health researchers or health and biomedical funders are feeling.
Great. Okay, so Amy, and then I think maybe we'll try to wrap it up with a summary of kind of where we are.
Thanks again for that. I just wanted to your point, Jeremy, I think there is a community of practice group around medical sciences, medical and health sciences, so there might be some relationship there as well. Although issues of funders aren't necessarily the same as issues of researchers, but the community of practice might be a useful umbrella for combining many of those issues into a conversational space. The other thing I wanted to ask the presenters especially is, you had some really great slides today, and did you have plans for sharing those slides? And if you do, maybe putting the links in the collaborative notes would be a way, or sharing those out to the people listed in the notes would be useful as well. Thanks.
Yeah, I'd be happy to share mine.
Yeah. Just to answer Maria, I know we have to finish. It's often a matter of vocabulary, Maria. So when people start talking about the problems, sometimes they go into domain jargon. And then it's harder to relate. Okay, so I do not necessarily agree, because maybe I've worked with people from all places, and in the end, there are specific problems, but then there are generic problems.
Great. Well, so thanks again, everyone, for joining us today. You know, we're at our time. So I think what we'll do at this point is just as a quick summary. I think some of the things we've heard are, you know, that there may be an interest in pursuing this in a somewhat, you know, narrow fashion, this issue of a cultural change, you know, recognizing that we have a number of activities that are going on that probably will be impacting it anyway, but those areas that are probably left unaddressed by things like policies and plans. So really considering issues of sort of incentives to make people want to share data. I think we probably also need to tackle the issue of whether they sort of can, you know, do those things that would be sort of incentivized as well. So I think what we'll do after this is to perhaps kind of go to the notes. We'll meet my co-presenters and I will sort of meet to talk about what we heard today, and then I think we'll write up either sort of a short summary or something with a couple of specific topics that maybe came out of here and see how this might map to existing RDA groups. It sounds like there's a couple of things here that might not map to existing working groups, but there may be some that could be referred to existing ones to sort of take up. So I think that's our plan for after this. Not a firm commitment that we'll create a working group or an interest group, but we'll sort of draft something up and see how that aligns with the current structure. Does that sound right to everybody?
And thank you, Taunton and Jeremy.
It was all Taunton. Right? So thank you, Taunton.
Well, thank you, Taunton.
Thank you all for joining. This was great. Okay. We will talk to you again soon. Bye.
Thanks. Take care.
So do I say farewell to you? Oh, just a second, Jeremy. Do you have 1 more second?
Yeah, of course.
Just maybe they'll throw us out of the session. Just a second.